This next one you're going to love. Dr. Wood is sitting here. We're about to have a chat because he's actually just come back from delivering a baby. Now, that brings us to our topic, because what are we to expect once we have a baby? Once, you know, baby's out here safely, like as mums, what can you expect?
It is a massive subject, so we'll just try and touch on a few things. Yeah. First thing is, basically, your life is different from now on, right? And that change from being able to go out for coffee and going out to watch a movie with, to suddenly having a little human who's 100% dependent on you, is a massive change. And it comes with that some issues. So one is you might find it emotionally challenging.
Just having to adjust.
Yeah, that's right. Yeah. You know, I always like to think about it that, you know, giving birth just a day.
Yes.
But after the baby's born, that's when the real hard work comes, and we often refer to it as the fourth trimester, right? That 10-week period, even longer. So issues that are happening, breastfeeding. If you can get your head around breastfeeding before the baby's born by going to a breastfeeding class beforehand, it makes that transition really helpful.
I did one. I would vouch for that, definitely. Breastfeeding class is very important.
It is physiological and normal for you to be really emotional 2 or 3 days after the baby's born. But if you find that those emotions are really carrying on for weeks and
you're just like baby blues, just crying all the
if you find you're not going out of the house, you're not sleeping even though you're tired, you're withdrawing from people, those are a sign that you may be having an issue, and go and see your healthcare practitioner, get some help. There's plenty out there, and it's a lot of people experience those postnatal depression, and get some help now, and it's really good to sort it out.
Even if a loved one sees it.
That's right, yeah. So
sees changes in you.
And just talk openly about it, and talk about the fact you're struggling. That is, you know, normal.
It's okay to struggle. The struggle is real, that's for sure.
And by going to a new mums class, where there's a whole lot of new mums with the same issues, with the community health have them,
helps as well.
Being with other mums who are having the same problems is really helpful to just get yourself through. Thirdly, you're going to have a lot of bleeding in those first few days and weeks after the baby's born. It's pretty hectic, so be prepared, get some pretty, you know, appropriate sanitary items ready for yourself.
That's you're not prepared for that.
And wear sensible undies.
Yeah.
Right? Don't try and be some glamour item at this point. It's all about being comfortable and sensible.
That's right.
So that should taper off after about 4 to 6 weeks, or maybe a little bit longer.
The bleeding.
Yep. If you're still having heavy bleeding, or it's getting worse, or you're feeling unwell, you should contact your doctor or your healthcare practitioner straight away.
Yeah. So by the postnatal check, your bleeding may, because it's about 6 weeks after.
6 weeks, it should almost have finished by then.
Yes.
And if you're breastfeeding, it may go a little bit longer. It's usually browny, sort of really old spotting sort of stuff. But if you're having continued heavy, fresh bleeding during that time, you should be contacting somebody just to get that checked out.
Definitely get that checked out.
So look, when this time comes, the best way to manage it is actually to be prepared before it all happens. Okay. Things you can do: try and go to a breastfeeding class before they give birth.
Yes.
Try and surround yourself with people that love you and support you, particularly your parents and mums. It's crazy how much having someone make meals or clean your house for you can really support you in this postpartum time.
Yeah.
And just go with the flow. Don't try and achieve everything. One day at a time, even 1 feed at a time, is the best clue.
I love that advice. Thank you so much, Dr. Peter Wood, for sharing that. I hope that's helped you. And look, keep it locked right here at Mums at the Table, and don't forget to subscribe to our YouTube channel.